Great. Good morning, everybody. We are just waiting for our other speaker who needed a link sending, so we won't be a minute and then we'll get started. Okay, we can start with the early. I think she's here now as well. Say hi, Sophie. Hi. Good morning, everyone. So welcome to our meeting of the Academic Research Group of the Outdoor Recreation Network. My name's Kate Dashbert and I'm chair of this group. If you could move the slide on, Kerry, please. So just a little bit of housekeeping. There's lots of people on the call today, which is brilliant. But so therefore, can everybody just make sure that they keep themselves muted if they're not speaking? The session is going to be recorded and we will be sharing it afterwards. There'll be more detail of that later. And please put any comments, any thoughts, any questions you have as the speakers are presenting into the chat, and we can refer back to them. And then afterwards, we will have time for a couple of questions where it will be possible to use the hand raised option if people want to, or we might draw some from the chat. Next slide, please. So the ARG is a part of the wider Outdoor Recreation Network. And the purpose of this group really is to try to make a bit of a bridge between academic research and practice. So we are organising quarterly online sessions to try to facilitate this greater communication, also better collaboration between the different parts of the outdoor recreation ecosystem in a way. So today's session is going to be bringing some new research findings, I think, from two of our two speakers. And really what we want this to do is to start conversations, to share the knowledge that's happening in the academic field with practitioners, and also for us to use this as a springboard to think about how we can collaborate better together. Next slide, please. So we've got two speakers today. Great speakers. We're going to have Sophie Lawson, who is at the moment working with Trash Free Trails and Edinburgh Napier University. And then afterwards, we're going to hear from Anand Jani, who is a research fellow at University of Oxford. So time is of the essence, as always, and we want to hear from our speakers. So we're going to start with Sophie this morning. And Sophie's presentation is called "Can Trail Cleaning Act as a Way to Reconnect People with Nature, People and Place?" So Sophie, 15 to 20 minutes, if that's okay. As I said, anybody who has any questions or comments as Sophie's speaking, please put them in the chat.
Thanks, Kate. Sorry, I just started sharing my screen and then couldn't take myself off mute, so I'll try that again. Great. Can everyone see the slides now?
Yes, but it isn't presenter view, but yeah.
Okay.
So if you go up to the display settings at the top, you should be able to swap them. Yep, there you go.
Perfect. Is that okay?
Yeah.
Perfect. Amazing. I can't see any of you now, but that's okay. I will persevere. Okay, so yeah, thank you everyone. Thanks for having me along today. I'm really pleased to be here. So as Kate said, my name's Sophie, and I'm working on a project which I think really suits the kind of essence of the ARG. So I'm leading what's called a knowledge transfer partnership, which is funded by UKRI. It's a government-wide scheme that kind of brings together academic institutions and partner organisations to do research in an applied context with real-world impact. So I'm working with Edinburgh Napier University and an organisation called Trash Free Trails to look at the impact of trail cleaning, aka litter picking, on our relationship to ourselves, to nature and the places that we care for. So really relevant to this theme of nature connection, environmental stewardship. And the project is called Routes to Reconnection. But yeah, just to start, I'd kind of like to start us with an experience rather than kind of talking at you in a traditional way. So this is an invitation. Feel free to take part or not. yeah, we'll spend, it'll probably just be like a few minutes just kind of going on a little imaginary journey. So if you'd like to kind of make yourself comfortable, you might want to step away from the screen. You might want to kind of close your eyes or soften your gaze if that feels comfortable. And the invitation is to bring to mind a place in nature that you love, that you feel connected to, that you enjoy spending time in. And yeah, that could be anywhere. That could be your garden, that could be a park, that could be a beach, that could be a forest. And bringing that place to mind, what do you see? What does it look like? What can you hear? What can you smell? Really bringing a sense of what it's like to be in this place. And as you do that, can you notice any changes in your body? How does that make you feel? How does it feel to be in this place, to remember this place? And now I'd like you to imagine that you're in this place and someone has come and they've trashed it. So there's broken bottles on the floor. There's maybe like a leftover fire pit. Someone's maybe left some of their camping equipment. There's dog poo bags everywhere. And people have not taken care of this place that you care about. And notice how imagining that makes you feel. Does that change your relationship or your experience of this place? And now I'd like you to imagine that you decide to take action. You say, you know what, this is a place that I care about and I'm going to do something about this. So you get yourself a plastic bag and you spend a bit of time picking up the litter, putting it away. And as you're picking up that litter, how might that make you feel? Putting the bottles and gathering that up and putting it into the bin bag. And then when you're done, taking a step back and to look at this place again, to see that it's been returned and restored to its original state. And again, imagining how that might make you feel, to look at this place that you care about and to know that you have given something back to a place that means a lot to you. How does this act of care, this act of stewardship impact on the place, but also how does it impact on you? I'm just taking a little bit of a moment here to reflect on that, to experience anything else that's coming up in this imaginary place. And yeah, maybe inviting a little sense of gratitude for this place that you've brought to mind and everything that it does for you. And then when you're ready, saying goodbye to this place, blinking your eyes open if they've been closed, maybe taking a little look around the room. And then when you're ready, coming back to the screen, back to the meeting. And yeah, if anyone wants to share their kind of experiences in the chat, then please feel free to do that as I'm presenting, and that'll be nice to kind of have a little look, just how people found that, what they experienced. But yeah, that's the kind of the essence, the flavor of what this research is trying to get into. And so I wanted to just give you a little imaginary taste of it before I kind of talked you through the presentation in a more traditional sense. So first of all, I'm just going to do a bit of an introduction on what is Trash Free Trails. So Trash Free Trails' mission is to reconnect people with nature through the simple yet meaningful act of removing single-use pollution, also known as litter. But the majority of what we find on our trails is single-use plastic, and it has a negative impact on the environment, so we refer to it as pollution. And yeah, we're primarily kind of, there's lots of different organizations that work on beaches and in towns and cities, but this is specifically about kind of working in more natural terrestrial places. And this slide is about the why. So why are we doing this project? Why does Trash Free Trails care about nature connection? So it's a litter picking organization. It's focused on this this kind of slide on the right hand side of the slide about kind of protecting nature. But there's increasing evidence and increasing understanding that all of these three things are linked through nature connection. So the UK ranks one of the lowest countries in the world for a connection to nature, mental well-being, and nature preservation. So we've lost more kind of biodiversity, forest cover than like a lot of other countries in the world. Like we're really in this crisis of disconnection in the UK. And increasingly, researchers are recognizing that nature connection, and by that I mean an emotional sense of a connection to nature where we feel a sense of kinship, we feel that we are part of nature, that nature is part of us, that this is really seen as a core root cause of the environmental crisis, and that it also has a really negative impact on our well-being when we feel disconnected from the world around us. So disconnection is seen as the root and the root cause, and reconnection is seen as the route out of it. And I've kind of put references in there, and I've got a slide at the end if anyone's interested in looking into that in a little bit more detail. So that's the sort of theory behind what we're doing. And Trash Free Trails have done a lot of really cool research on the environmental impact of litter. So they've been going for the last sort of like 5 or 6 years. We've got an impact report, we've got the State of Our Trails report. So every year we report on what we find all over the UK based on thousands of citizen scientists who go out, they survey what they find and give us a breakdown of what we find, where we find it, what brands we find. And there's really cool research that you can go and look at through the links in these slides. But as the team were kind of working through this, it started to bring the question of, well, what impact does it have on us? Like we see that people come on these trail cleans, we see them see anecdotally the positive impact that it has on them, that people say that they would love to come and take part again. This quote from a participant, that I feel fulfilled, I feel purposeful, I feel respectful, I feel like I've given back to my local community and I've made a small difference. And it's a sense of agency, which we know is really important psychologically for well-being. So the team started to ask the question of like, okay, well, what impact is this having on us, and can we do something with this? So that's sort of where this project came from. Being a researcher, obviously the first place that I went to was to look at the literature, and there really isn't a lot on this topic. So I managed to find 2 papers in total that kind of looked at the psychological impact of litter picking. And again, I've put the references in at the end. And the sort of main findings from this was that it often brings up mixed feelings for people. So yeah, feelings of anger, of sadness, of kind of seeing the litter, but then a sense of kind of pride and happiness, sort of being able to do something about it. Litter picking kind of has the potential, so that we know that natural environments have this restorative quality, like they can help us de-stress, they can help us, they can improve our well-being, and that litter picking actually potentially reduces that because you're paying less attention to the environment and more attention to the litter that you're finding. But that is counterbalanced by this kind of increase in purpose and meaning. And this question around nature connection, no one's actually really looked at that yet in terms of the impact that litter picking has on nature connection. So that is where this project was born from. And its sort of ultimate goal is to understand these processes and try and capture them. With the intention of developing trail cleaning or litter picking into a social prescription that improves our well-being, but also kind of gives something back to nature. And yeah, this kind of interconnection of when we feel connected to nature, we're more likely to care for it. So something that can have a positive impact on the environment, but a positive impact on us at the same time. So this is the project that I'm working on. The first year is going to be primarily about kind of building the evidence, because there isn't a lot out there at the moment. So we've just kind of started fieldwork, and I'm going to present some very early findings from what we're kind of finding so far. But the kind of overall kind of approach is we've got a survey that's gone out that's kind of looking at questions of well-being and different types of connection before and after trail cleaning. I'm going to be doing a whole load of interviews with different volunteers and different people involved in different organisations, and I'm also going to be going out and participating in and observing trail cleans and the kind of processes that are ongoing to kind of really try and get an understanding of what the impact that it's having and how that impact is being achieved. So yeah, the fieldwork was sort of in fieldwork season now, so from about June until about October, November, and then over the winter I'll be kind of going into analysis mode, and we've got a report that's coming out in March, and we're also going to have academic outputs around the same time. And so yeah, we'll be going into the spring, we'll be reporting. But yeah, I just wanted to find some like of a very, very initial, hot off the press, haven't been published yet, findings from this initial kind of month or so of data collection. So first of all, just asking people how they feel. This is very reflective of what we found in the literature, that there is this real kind of mixed bag of people feeling proud and happy and purposeful in removing litter, but also feeling disappointed, frustrated, sad that the litter is there in the first place. Excuse me. And this is the kind of findings that we've got around connection. So just a little bit in terms of sample, this is from 64 participants across 6 events that we had in June. And all of the results that I'm going to show you are statistically significant, which I was actually kind of surprised by with quite a small sample size. But yeah, so we've seen that before and after trail cleaning, people are reporting an increase in connection to the places that they clean, an increase in connection to nature, and an increase in connection to others. Interestingly, the connection to nature is actually the smallest increase, and the connection to place is actually a lot bigger. So that's something that, yeah, through the kind of more qualitative work, we'll be able to kind of understand that a little bit more about what the processes that are happening there. And that also this kind of part of like taking part in a community event seems to be having quite a kind of strong impact as well. And then in terms of well-being, so 76 participants reported an increase in their kind of overall well-being after trail cleaning. We've been working with something called the PERMA model of well-being, which has it kind of looks at well-being and breaks it down into these 6 different factors, which are along the bottom of that graph there. So to experience a kind of a well-being, there's different aspects of it, and one being a sort of positive feeling, positive mood, sense of feeling engaged in the world and what you're doing, relationships, so feeling connected and supported by others, having a sense of meaning, a sense of purpose, having a feeling of accomplishment, and then also kind of physical health was added in there as an important component of well-being as well. So we've kind of looked at all of those, and again, people coming to our trail cleans actually starting off quite high and experiencing a kind of small but positive increase in all of those factors before after trail cleaning. And the graph on the bottom right hand side kind of shows the change, so you can see a little bit more clearly that accomplishment, a sense of accomplishment, and a sense of connection to others is the sort of places where we're seeing the biggest change, the biggest improvement. Yeah, so that's our kind of very initial findings so far. And again, like I said, we're going to increase the kind of size of the pool of this data across different events, and then flesh it out with a lot more qualitative work. So in terms of the kind of next steps and the plan for the project, as I said, data collection is going to be going over the summer and the autumn. We're also collecting quite a lot of information on different demographic variables, different factors around the trail clean itself. So whether or not like things like the weather or the group size or the amount of litter that there is or the type of environment that it is, so that we can start to understand which of those factors influence these outcomes. So that we'll hopefully then have a really good understanding of what impact it's having, how that impact is, like the kind of mechanisms of change of that impact. And then hopefully by the spring, the plan is to kind of develop a pilot of a more kind of targeted trail cleaning for nature connection and well-being, and then to evaluate that next year. And then the kind of output of this project will be developing resources, we'll be developing toolkits so that other people can go out and run these trail cleans for themselves, and yeah, hopefully bring these benefits to more people and to more natural places, which would be great, a great outcome. So that's the plan. However, you don't need to wait until 2027, 2028 to start getting involved. So Trash Free Trails are a community-based organisation. We're a team of 8 people, and we mostly rely on amazing volunteers all over the country getting involved and giving something back to the places that they love. And Trash Free Trails have this kind of philosophy of DIO, which is like do it ourselves. So the kind of collective sense of community action. So there are already toolkits out there if you want to organise your own trail clean, of how to do that, how to survey what you find, how to report that data so that you can contribute to this global data set of the pollution that's out there, and contribute to advocacy to kind of work with different organisations and lobbying the government to kind of reduce that. And we've also made our kind of experience surveys and questionnaires open access, so that if you do take part in a trail clean, you can tell us how it made you feel, and you can contribute to the research that's going to be developing this understanding, this evidence base, and these pilots. So yeah, the links to all of this will be put out in the slides. We do also organise trail cleans which you could just come along to. I think we won't have loads until the autumn, but I think mid-October is our sort of big autumn cleanup. And so yeah, all of the details for that will be on our website if you just want to come along as a punter and have an experience. Those are the references for anyone who's interested in having a bit more of a look at the academic literature. And that is me. I've even finished 2 minutes early, which never happens. So yeah, thank you so much for your time, and yeah, really happy to take any comments and questions.
Thank you, Sophie. Always a real pleasure when somebody sticks so well to time as well. So great start. And also a really interesting project there, showing some evidence that people actually gain well-being benefits from doing proactive things in nature to help support nature recovery. So that's a really positive message, I think, albeit with the slightly negative message of the amount of litter that we're seeing. So we have some time for questions. So if anybody would like to ask Sophie a question or make a comment, either put it in the chat or you can raise your hand and speak directly to her. I think for this group, I think another really interesting thing about having Sophie on the call today as well is the fact that this has been done through something called a knowledge transfer partnership, which is a really good way of academia and I guess business mainly working together. So we could ask Sophie to maybe say a little bit more about that as well. Sophie, could you put the last slide up on the screen whilst we're talking? Tim would like to see. I think it's the references he might like to see.
Yeah, the last slide
your contact details, which is much more interesting.
Yeah, that was the last slide. I'm not sure if that was the slide that you wanted, Tim. Can maybe give us a thumbs up, or if you wanted the reference slide, I'm very happy to put that one up as well.
Yeah, and then we have a comment from Rosaline there that she really enjoyed the grounding experience, and so did I. It was a good start. So I think we have Tim's raised his hand. So Tim, would you like to ask your question?
Yeah, sorry about that. I meant to give you a thumbs up and it came up as a hand instead. But that was a great chat, and great talk. It was me who asked if I could see that last slide again, because it's some really useful information there. I work for Dartmoor National Park, and our rangers do quite a bit of litter picking and so on, and I just thought that perhaps we might maybe get involved in some of your survey work, but at least I've got your details there and I can pass that on to our ranger team and so on. But thank you very much for that, and I'll try and work out how to get rid of my hand in a minute.
So okay. I know now.
Thank you very much. It was great. Thanks, Sophie. That was good. Thank you.
Thanks, Tim. Yeah, and the best place to kind of go if you're interested in getting involved is just on the website, and then if you've got any questions, you can either get in touch with me, or we also have a community coordinator who sort of supports organisations wanting to get involved. And there's also, if you are working for an organisation, we also kind of have a network of what we call community hubs. So they're kind of organizations who decide that they want to, I think it's 4 trail cleans a year that you do, and then we kind of give you like resources and support, and that's a really good way of kind of like getting involved with all of the surveying and everything. Yeah, it's just if you're already doing litter picking, it's a nice thing to make what you're already doing be even more meaningful, even more purposeful, and have even more impact. So yeah, definitely have a look if you're interested.
Great. Shall we go to Dan?
Hi, Sophie. Dan Cook from Forestry England. We already run quite a few trail cleans with you and have a partnership with Trash Free Trails, and I would encourage other organisations to do the same. I think it's been incredibly insightful, and really enjoy working with yourself and Rich and Dom. What I am really interested in is, in the perfect world, we wouldn't have to have trail cleans. People would know not to drop litter, etc., and all that sort of stuff. Clearly, we're probably never going to get there. But as part of the research, are you looking in any way, or are there any thoughts towards preventative elements, as opposed to, I wouldn't say it's reactive elements, because it's incredibly positive, the work that you do in terms of how people feel being involved, but like, yeah, in a perfect world there would be no need for trash free trails, would there? There would be no trash on the trails. So how is there any way of or thought around exploring the message to say, take your litter with you in the first place?
Yes, no, it's a really good question. And the answer is sort of yes and no. So it depends how far upstream that you want to go. So Trash Free Trails have done a little bit of work around, so they have these signs, which you might even have at some of your sites, that are sort of based on behavioral psychology, that when you kind of give people nudges and you kind of put it's really funny, if you put eyes on signs that say do not litter, that actually, like, people feel like they're being watched, and it kind of does something in your brain to kind of makes it even more effective. So they've kind of done a little bit of work on some of the research around that, and kind of trying to do things like signage. And there's also a kind of whole Trash Free Trails education program where they kind of go into schools and try and get people from very young ages thinking about litter in a different way. So yeah, Trash Free Trails are doing work around that, and the theory of kind of reconnecting with people, with nature, and that being like the root cause of like why people one of the reasons why people drop litter in the first place is that people don't see the natural world as being something that is part of them, that they need to care for. So that's sort of like, that's how this project taps into it. But in terms of just like the scope of the project, like looking into the sort of behavioral science of littering and preventative action, I mean, that would be a whole other, you could do an entire knowledge transfer partnership on that. So yeah, I've sort of put that slightly out of scope for my work, but yeah, it's really, really important, and yeah, it's something that Trash Free Trails are aware of and doing good work on.
Brilliant, thank you. Yeah, I appreciate it. It would be a big change in scope, wouldn't it?
Yeah.
Include that. Yeah, thank you.
Great, thank you, Sophie. I'm just aware of time as we have a second speaker today as well. So I wonder if, David, I could ask you if you wouldn't mind putting your question in the chat, and then Sophie could respond in the chat, if that's okay. And you also have a question from Ali in the chat as well, if you could take a look at them. Thank you. Just want to make sure we stick to time and also leave enough space for our second speaker. So big thank you to Sophie. That was brilliant, and I think we'll have raised all sorts of questions and ideas for people. So please do get in touch with Sophie, and we will be sharing the slides and all the links with everybody after the meeting. So next we will move on to our second speaker then. So we've got Dr. Anand Jani on the call. I'm just looking to see if I can see him.
Yep, I'm here. Can you hear me?
Oh, you are here. Yeah, we can hear you. Yeah, brilliant.
Just
So
gonna,
I'll hand over to you, Anna. Are you doing your own slides or is Kerry going to do them for you?
I sent my slides, but I can share as well. Does that work? Can you see my slides?
Yeah, they're not full screen, but yeah.
Okay. Okay, so if I go full screen, I won't be able to see you guys anymore, but I'll crack on. So the presentation here sort of ties into what Sophie was talking about as well. Looking at, I think Sophie in passing mentioned kind of packaging this trash, litter picking as an intervention, a social prescription of sorts. And I guess I'm going to kind of sandwich that looking upstream as well as looking downstream in terms of what we mean by healthcare outcomes. So as a starting point, maybe we kind of disaggregate what health actually means. I come from a healthcare background, and I've worked with Natural England for a while, looking at social prescriptions and green prescribing. And so a lot of what I'll go through is kind of seemingly basic, but I find that a lot of people that don't work in healthcare sometimes don't know some of these concepts. So I'll try to go through some of these things a little bit quickly, and you can get all the slides afterwards as well. So as a starting point, my positionality, I look at One Health as a kind of starting point in terms of the definition of health. This also ties into something that Sophie mentioned, looking at the kind of intersection of nature and human health. And so One Health is something that was conceptualized by the WHO several years ago, and it looks at this integrated approach of balancing and optimizing the health of people, animals, and ecosystems. So they're all kind of intimately linked together. You can't have one without the other. And if one is out of balance, then the others are going to be out of balance as well. And if we look at One Health, and we can kind of broadly disaggregate at least human health outcomes by length of life and quality of life, and there are debates as to whether these are the best metrics, but these are metrics that are normalizable across both space and time. If we look at these two metrics, clinical care, so this is access to hospitals, doctors, nurses, pharmaceuticals, diagnostics, only accounts for about 20% of health outcomes. The other 80% are these determinants: health behaviors, social and economic factors, and physical environment. So two kind of nuanced points. One is the distinction between health and healthcare. So the title of the talk is looking at healthcare outcomes. Healthcare outcomes would be things that are delivered by this bit. So healthcare is doctors, hospitals, nurses, pharmaceuticals. Health is much broader than that. It includes all of these determinants of health. And when we're looking at both health as well as health care outcomes, what we find is that there's a lot of quote unquote bad choices that the lowest socioeconomic groups in particular take that impact their health trajectories, as well as their health in the short term. And I've highlighted bad choices in red, and it's something that I'll come back to. And these guys who wrote this BMJ paper also put it in quotation marks for a reason. And so if we look kind of broadly at these determinants of health, you can very generally disaggregate them into social determinants, digital determinants, commercial determinants, environmental determinants, and political determinants. None of them are mutually exclusive, and they're all interacting with one another in sometimes predictable and oftentimes unpredictable ways. Digital determinants is maybe something that people have they've not seen before, but if you've been kind of looking at the headlines of news, you see the social media bans for the under 16s, and the reason for that is because people are, these young folks, whether you agree with it or not, they are using social media a lot. They're kind of addicted to their phones. They're addicted to gaming. They're addicted to gambling, and so the digital determinant is, in that sense, directly impacting children and youth's mental health and well-being. Digital determinants also are impacting the environment. So the data centers that are taking up land, the global greenhouse gas emissions that come from the data centers, and the fresh water use of the data centers as well is something that's quite stark and quite startling. in Spain, there's an initiative called Your Cloud is Drying My River, because there's a lot of concessions that are being given to the large tech companies to open up data centers, and they can only open up the data centers around a source of fresh water currently, because they need the fresh water to cool the data centers. They can't use salinated water because that would corrode the equipment. So anyways, looking at some of the intersections, for education, for example, which would be a social determinant, there's a dose-response relationship where there's an average mortality risk reduction of about 2.9% for every additional year of education. Unemployment increases all-cause mortality, and then it also leads to a penumbra of other negative impacts: mental distress, substance abuse, depression, anxiety. The environmental determinants of health account for about 13 to 32% of global disease burden, and we're kind of seeing this right now in real time with the severe heat events and the heat waves in the UK as well as across Europe. And for industries, tobacco, unhealthy food, fossil fuel, and alcohol are responsible for over 30% of annual global deaths. And this has obviously commercial determinants, these foreign industries impacting social determinants, and they're facilitated oftentimes by political determinants because the policy landscape allows some of these actors to continue working in a fairly unregulated manner. So what we would sort of conceptualize is looking at all of these different determinants working together to deliver One Health. So currently, in some cases, they are delivering One Health. In a lot of cases, they aren't delivering One Health. And when we're thinking more broadly from a systems perspective, both for human health as well as nature's health, by nature's health, I mean both ecosystems as well as animals, looking at biodiversity as well. We can sort of think about this from a heuristic perspective, and this graph comes from Jeffrey Rose, who is an epidemiologist at the London School of Hygiene and Tropical Medicine. And what he says is, if we look at the risk of getting severely sick, so this is low risk, medium risk, high risk, and this is the percentage of the population. Most systems, whether that be healthcare systems or environmental systems, focused on the highest risk groups. And we oftentimes intervene when people are already sick or when the environment is already sick. But what Rose says is that if you want to improve the entire health of the population, or in this case, if we're looking at One Health, of the ecosystem, you need to shift the entire risk profile to the left. So you're not just focusing on this group, but you're shifting the entire risk profile to the left. And in order to do that, you obviously have to continue working with the people that are at the highest risk, but you really need to shift your focus to the folks who are in the bell of the bell-shaped curve, because though they're lower relative risk, there's a higher absolute number of events that can happen in the bell of the bell-shaped curve. If you do not shift the entire risk profile to the left, it will continue drifting to the right. And as we drift to the right, the intensity and cost of interventions will increase. That goes for both human health as well as for environmental health. The more we delay tackling climate change, the more we delay integrating nature-based solutions into our environments, into our ecosystems, etc., the more we're going to have to pay, and the more people are actually going to suffer as well. And so if we look at the health impact pyramid in terms of actually impacting the health of individuals, here what you have is this sort of kind of busy triangle where you have increasing population impact and increasing individual effort or need. So the other way you can look at this is increasing resources, and this is increasing population impact, but you have a relative low amount of resource. These are the socio-economic factors. So access to housing, green space, clean water, clean air, etc. This is changing the context to make the individual's default decisions healthy. So looking at the health opportunity architecture, as we would say in public health. long-lasting protective interventions. So this would be physical activity and dietary interventions. It would be medications as well, statins. Here, you sort of have this fine line between some of these types of interventions and the clinical interventions, and then counseling and education, which is usually going to be one-on-one. So as you go down this pyramid, you do more population-based stuff. And as you go up the pyramid, you do more individual focused interventions. And these will always be more expensive than these. Sorry, I have somebody at the door. Really, sorry about that. I'll be back in 1 second. Sorry.
Okay, no problem. Any comments or questions for Anand, please do put them in the chat as well. And Sophie's been replying to questions there as well.
Sorry about that. Hazards
Okay.
of working from home. Right, and then if we look at the types of intervention that we can actually look at, and I think this also ties to some of the stuff that Sophie was mentioning, we have these kind of three broad different types of prevention. Primary prevention, secondary prevention, tertiary prevention, and the same concepts actually apply here as well. Primary prevention will be at a population level, and here what you're trying to do is to prevent people from getting sick in the first place. I think it sort of links to the comment from one of the colleagues, I think Dan from Forestry, England, as well as something that Sophie mentioned, which is namely, how do you prevent people from polluting in the first place? Why can't we just as a default have healthy, clean green spaces? Secondary prevention is where you've actually identified a problem. You've diagnosed somebody with type 2 diabetes or hypertension, or you find a green space that has litter. And here now you can actually work to intervene and get that condition into remission. So some of the litter picking would be a secondary prevention intervention where you can actually clean up the green space itself. And then you have tertiary prevention. So this is somebody who's been, from a health perspective, living with type 2 diabetes for 20, 30 years. And it's not that they're past the point of no return, but now what you're trying to do is you're trying to prevent the severe exacerbation of their condition. So they're now in this group. So this would be secondary prevention. This is primary prevention. This is tertiary prevention. And the costs are all kind of different. Tertiary prevention will always be more expensive than primary prevention. So it's a sort of adage of an ounce of prevention is cheaper than a pound of cure. So let's look at the health of England currently and how it's actually impacting health outcomes. So these are some pretty stark stats right now. England, from a population health perspective, is not doing well. Long-term preventable conditions, we're spending about 154 billion pounds per year, which is about 70% of the total NHS spend. And these are the types of conditions like type 2 diabetes, high blood pressure, overweight, obesity, mild to moderate depression, anxiety, as well as cardiovascular disease. 86 million antidepressants are being prescribed to about 8.6 million identified patients. This is definitely an over-diagnosis and over-prescription. There are many of these individuals who, if they had access to kind of a nature-based intervention or a green prescribing intervention, something like what Sophie was mentioning, they could do without the antidepressant. And some of the physical activity interventions and non-medical interventions are oftentimes more effective than the antidepressants. And if we look at aggregate, I've been working in the NHS since 2011. So if we look at the right side of this first, when in 2011 we were spending about 110 billion pounds. Fast forward to 2019, this pre-pandemic, we were spending 140 billion pounds, and that was above inflation. 2026, so currently we're spending 220 billion pounds on the NHS. So in a matter of 15 years, 5 years, we've doubled the amount that we've spent on the NHS. And what have we gotten for that? We have over 7 million people waiting to get care. Life expectancy has declined. Healthy life expectancy has declined. That was published about a month or a month and a half ago, where we've seen about 1.5 to 2 year decreases in healthy life expectancy for both males and females. We're seeing quite dramatic increases in health inequalities, dissatisfaction with the NHS, strained relationships at work within the NHS, and 30% of staff are at risk of burnout in the NHS. So we're spending more money and we're actually getting less health within the population. So we basically have this rightward drift that Jeffrey Rose was talking about. We're spending more money, but we have a sicker and sicker population. And one of the key kind of issues with all of this is this notion of medicalization, which is we're making medical things that are non-medical in nature, and we're treating them as medical problems, as diseases or disorders. This is a very well-established phenomena, and it always leads to more and more interventions, more and more medications, and less resilience within the population as well as within the individual. And again, this is a fairly well-documented phenomena. So this is a book called Overdiagnosed, Making Sick in the Pursuit of Health. Gilbert Welch was at the Dartmouth Institute in the US. And then this is the classic from Ivan Illich, Limits to Medicine, where we're basically creating this dependency within the population, within the psyche of the population, as well as within how our care pathways are actually set up and how our societies generally are set up, where the medical answer is sometimes seen as the only answer to promote health and well-being. So where does green space use and access actually help this? I think the biggest thing from my perspective is the primary prevention. If we give people access to good quality green spaces, they have access to good quality pathways, they can connect with nature, as Sophie was saying. Sophie's example was the act of litter picking, but if we have one of the earlier comments that she made, this notion that people see themselves as stewards of England's or the UK's natural spaces, they will want to take care of them, they will want to spend time with them, and that will automatically be good for both the physical health as well as mental health. Secondary prevention, when people are diagnosed with a condition like type 2 diabetes or mild to moderate anxiety, depression, that time in nature can help to get them more physically active. It can help to calm their sort of anxieties, etc., and improve their mental health. And I think also for tertiary prevention, it has a role to play as well. So I think across all of these domains, but if I was to put my money on something, it would definitely be primary prevention and secondary prevention. And the evidence is there in terms of looking at health care outcomes, in the sense that we can reduce the burden on the NHS, as well as improving health outcomes, so for the individual themselves. So spending at least 120 minutes a week in nature is associated with good health and well-being. And this is just looking at the 120 minutes. It could have all sorts of you could have formal access, you could go to some of these honeypot sites like the Lake District, etc. Or it could just be your neighborhood park where you sit down and have lunch for 30 minutes and you're able to listen to the birds, hear the leaves rustling, and then go for a walk in the park with your dog, etc. And then ambient greenness or access to local green spaces also has substantial mental health benefits. So this was a 10-year longitudinal study that was published in The Lancet, looking at 2.3 million adults in Wales and looking at common mental health disorders. So this is the kind of mild to moderate anxiety and depression. And green social prescribing, which is also something Sophie was alluding to, is something that we can formally integrate into care pathways as part of secondary prevention. But again, I would strongly advocate for primary prevention. And so looking back at that health impact pyramid and looking at this second tier from the bottom, changing the context to make individuals' default decisions healthy. So again, here, I think a key is looking at the opportunity architecture. So ensuring that everybody actually has access to not just green space, but good quality green space. So this is from the looking at the 15-minute walk commitment. So of the 26 million households in England, about 80% have access to a 15-minute walk, about 76% to a 1 kilometer walk from their home, within their neighborhood, access to a green space. Local is only 14%, so this is a 0.3 kilometer walk, and then doorstep is about 16%, which is a 0.2 kilometer walk. One thing that this does not capture is the quality of the green spaces. So yes, they may have access, but if it's littered with trash, then it's not necessarily going to give that sort of experience that we're hoping for. So last slide. Looking at green space use and access, I think a fundamental question that we should all be kind of asking ourselves is it a right or a norm, or is it an intervention? So if I do the right side first, the clinical intervention, we would have signpost and referral. It's self-delivered in the sense that somebody kind of medicates by accessing green spaces. And if they're feeling anxious or depressed, then they go for a walk. And that is sometimes linked with a provider, a local provider. You can have individual level interventions or small group interventions. You can have a very small kind of scope. It could be short to medium term, usually for these types of clinical interventions. And in terms of who pays, you're looking at VCSEs, local authorities, philanthropy, citizens, NHS. And the attribution of this intervention to the impact on green space is actually quite feasible because you have people accessing and you can do pre-post measurements. If we're looking at green space use and access as a right or a norm, we're in these two kind of tiers of the pyramid. We need good planning. We need to ensure that people have access, ideally at that kind of doorstep or local level. And we also have to look at the equity and equality issues around this. I think Ramblers have done, I know Ramblers have done some really fantastic work on looking at access and inequality of access to pathways in particular. Fields and Trust has also done this. Who delivers it? Well, this is where we kind of get away from medicalization. It's self-delivered in the sense that individuals and groups and families and neighborhoods and whole populations can actually use this, and it's routine for them. This is not something separate. This is just part of their daily routine. They walk through the park to drop their kids off at school. They sit in the park to eat lunch. They go to the walk for a jog or physical activity, etc. It has very large scaling potential. So this would be pretty much at an individual level. This would be at a population level. The impact would be sustained as well, as long as the green spaces are able to be maintained. And then in terms of the payment, local authorities, private, looking at public rights of way in privately owned land, and then citizens also paying for access, but getting involved, like the intervention Sophie was sort of showing. The attribution for something like this, meaning if you're able to get more green spaces, can you say definitively that this led to improvements in population health? The attribution would be difficult, but it can be done if you're looking at a large enough population for a long enough period of time, like the Lancet study, this one, which looked at 10 years and 2.3 million adults in Wales. So that's all from me. Sorry if I went a bit over time, and then also for needing to get the door.
No problem. Thank you, Anna. That was really, really interesting and very some lots of data there, lots of complex ideas explained in a very quick time. So thank you for that, showing those connections, those possibilities, I suppose, between outdoor recreation, green space, and health. So we don't have very much time left for questions, but you have a few comments in the chat from people who've really appreciated the presentation. Ellen from Forestry England has used a similar wellbeing pyramid as well. So perhaps if there's any questions, we could ask people to put them in the chat for Anand, and I'm assuming he will be happy to respond to them. So I'm just aware everybody will have other things they need to get onto. So I just want to say a big thank you to both Anand and Sophie for today. So this is one of the themes that we definitely want to develop more in the ARG, looking at the links between outdoor recreation, health and well-being. So if you or or you know of anybody who you think might be a good person to speak, then please do get in touch with us. Our next meeting is going to be on the 17th of November, so we'll be sharing information about that. I also just need to say the ORN masterclass is happening the 30th of September and the 1st of October, and that's available for sign up now. If you look on the ORN website, you can see that there. And we will be sharing today's slides and recordings with the network and then more widely as well. So I just want to say thank you to everybody for joining today. And I think we've had two really interesting and quite different but thought-provoking speakers today. And the comments in the chat suggest everybody's found that really helpful as well. So we hope to see you again in November or in September for the masterclass. And then we finished on time. So thanks, everyone.
Thanks,
you very
everyone. Have a
much.
good
Thanks,
day.
bye.